Thank you for your interest in the Rural Health Clinic program. You've accessed Part 2 of the 5-part session entitled Rural Health Clinic 101. The Rural Health Clinic 101 session is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the Rural Health Clinic program, please access Part 1 as well as Parts 3 through 5 of Rural Health Clinic 101, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health. Rural Health Clinic 101, Part 2, Rural Health Clinic Qualifications. In Part 1, we discussed 3 basic qualifications that are essential to the certification of a rural health clinic. In Part 2, we will introduce 3 additional requirements that are necessary for clinics to qualify for the Rural Health Clinic program. The first 3 basic qualifications discussed in Part 1 were that the Rural Health Clinic had to be located in a rural area. The Rural Health Clinic also had to be located in an area that was designated as an underserved market. And finally, the Rural Health Clinic had to primarily provide outpatient primary care services. In our next set of qualifications, we start with what's entitled the mid-level practitioner requirement. Now, mid-level practitioners is a general reference to non-physician practitioners such as nurse practitioners, physician's assistant, or certified nurse midwives. The requirement for Rural Health Clinic certification is that a mid-level practitioner must be available to provide services at the Rural Health Clinic at least 50% of the time that the clinic is open. So the time the clinic is open is generally the operating hours of the clinic, and that becomes the denominator in the equation to determine 50%. The numerator is the amount of hours, essentially, that a nurse practitioner, a physician assistant, or a certified nurse midwife is available to furnish patient care services. Somewhat related to this mid-level practitioner requirement is the requirement that at least one nurse practitioner or certified nurse midwife or physician and assistant must be a W-2 employee of the Rural Health Clinic. This requirement has changed somewhat in recent past, in that at one time all of the nurse practitioners or physician assistants had to be considered employees of the Rural Health Clinic. However, that requirement was since modified to include the requirement that only one of the nurse practitioners or the physician assistants must be employed. Others can be contracted by the Rural Health Clinic for staffing and providing Rural Health Clinic services. All the time that the mid-level practitioner is present in the clinic during the clinic's operating hours are counted toward that 50% requirement. This is without regard to whether or not the mid-level practitioner is actually seeing patients in the clinic at that time. So if you have a nurse practitioner or a PA staffed in the Rural Health Clinic and available to see patients, even though they may not be seeing patients at that exact time, the time that they're available is counted toward that 50% hour requirement. Also, when a mid-level practitioner furnishes Rural Health Clinic services outside of the clinic, for example, in the patient's home or in a skilled nursing facility or other residential facility, the time spent providing Rural Health Clinic services outside the clinic may be counted towards the 50% requirement as well. There's 2 qualifications for that statement. Any travel time to and from the location for which the non-physician practitioner is rendering RHC services, for example, in the patient's home, the travel time from the clinic to the patient's home or from one patient's home to the next is not considered available patient care time in order to be counted as part of the 50% requirement. The second element that we wish to discuss today, and a requirement of a rural health clinic, is that the rural health clinic must operate under the medical direction of a physician. The clinic must be under the general medical direction of a physician who's responsible for the quality and the appropriateness of the healthcare services rendered within the rural health clinic. Only a medical doctor or a doctor of osteopathic medicine, a DO, can serve as a rural health clinic medical director. The clinic must document, and that documentation must be available in the clinic, identifying the name, address, and phone number of the clinic's medical director. This is often done either in a patient brochure, which can be available to all patients in the lobby, or it can be posted on a sign visible to all patients and family members who present at the clinic. If there are changes in the physician's responsibility for medical direction, for example, a physician retires and is replaced by a different medical director, it's the responsibility of the clinic to immediately notify their appropriate survey agency of that change in the medical director of the rural health clinic. As noted in the rural health clinic regulations, the rural health clinic medical director is responsible for the overall medical direction of the clinic's clinical activities. They're required to provide clinical consultation and supervision of other physicians who may be working in the rural health clinic, as well as non-physician practitioners on the RHC's healthcare staff. While the medical director is not required to be on site in order to perform their medical director duties, there needs to be documentation in the clinic that identifies and demonstrates that those medical director responsibilities are being fulfilled on an ongoing basis. Traditionally, there had been a requirement that a physician must be available on site in a rural health clinic on a periodic basis. While that physical on-site presence is no longer required, none of the responsibilities of the medical director have been reduced. In most instances, a medical director will periodically visit the rural health clinic in order to demonstrate their active involvement in the medical direction of that rural health clinic. Those visits, as well as any activities related to the supervision and consultation of rural health clinic practitioners, should be documented to demonstrate that the medical director requirement is being met. The final qualification we wish to talk about today is the qualification around the performance and rendering of basic laboratory services. Every rural health clinic is required to provide a certain level of basic laboratory services which are considered essential to the immediate diagnosis and treatment of the patient. At a minimum, the 6 basic laboratory services showed on the slide must be performed by the rural health clinic. It's not a requirement that in every instance that a patient is required to receive one of the 6 basic lab services, that lab service must be performed in the rural health clinic. However, a rural health clinic must demonstrate its ability to perform these 6 basic laboratory services and maintain adequate staffing, equipment, and supplies necessary to perform each of the 6 basic labs services at all times the rural health clinic is open. Compliance with the rural health clinic qualifications is determined through an unannounced survey conducted by a state agency or a private deemed organization during the rural health clinic certification process. All 6 of the qualifications that we talked about, the location in a rural area, the current designation as an underserved area, the provision of outpatient primary care services, the mid-level practitioner requirement, as well as the medical direction and the furnishing of the 6 basic lab services are verified through an on-site survey prior to rural health clinic certification. In most states, including the state of Wisconsin, a state agency no longer provides initial certification and survey for rural health clinics. Therefore, organizations wishing to pursue rural health clinic services and certification must contract with one of 2 deemed organizations who conduct Medicare certification surveys for rural health clinics. Thank you again for your interest in the Rural Health Clinic program. You have participated in part 2 of the 5-part session entitled Rural Health Clinic 101. For additional information about the Rural Health Clinic program, please access part 1 as well as parts 3 through 5 of Rural Health Clinic 101, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health.